Before we dive into content, we'd like to take a few minutes to provide you all with some helpful background information. First, we'll introduce the host of the webinar. My name is Talia Ramella, there on the right. I'm Senior Program Associate at Cities of Service, and I'm also joined by my colleague Nicola, who will be moderating today's virtual panel.
Hi, everyone. My name is Nicola, as mentioned, and I'm the Director of Engagement and Programs at Cities of Service. On behalf of everyone at the organization, thank you for making time out of your busy schedules to join us on this virtual webinar. And a super special shout out to all the beautiful panelists you're seeing on your screens right now. At Cities of Service, our mission is to help mayors and city leaders tap into the knowledge, creativity, and service of citizens to solve public problems and create vibrant cities. You've just heard me use the word citizen. For us, the word citizen is not a legal term. Cities of Service believes that citizens are residents who participate in their community and who see themselves as integral parts of their city. To respond to the current health crisis, Cities of Service is making our resources available and flexible so that our grantees are able to apply impact volunteering and engagement strategies to both immediate and long-term needs of vulnerable populations. With that said, we're also gathering needs and opportunities from our coalition cities to better understand what additional resources might be needed and which partnerships we should forge in order to be of greater service to the coalition. We understand that each city has their own understanding of vulnerable populations. For the purpose of this webinar, we have shared our working understanding with the panelists. And for us, vulnerable populations include the following: small business and women-owned businesses, individuals experiencing homelessness, elder population, low-income individuals with health issues, non-English speakers or English as a second language, undocumented individuals, youth of color including LGBTQ, and gig workers. We're making vulnerable populations a focus within our COVID-19 work because our coalition cities are making it a priority, and because our grantees have shown us that with intention, resources, and action, it is possible to engage and serve stakeholders cities have struggled to engage in the past. Lastly, research continues to show that the underlying health disparities in our cities will be magnified as a result of COVID-19, and that those consequences will be felt in every sector of society. With the ever-growing data made available, we are starting to get a picture, like a sneak peek of what this actually means on the ground. According to data from the city of Chicago, African Americans comprise 30% of the population, but make up 52% of the city's COVID-19 cases so far. African Americans are also making up 72% of the city's deaths from COVID-19. Here in New York City, a weekly tracker survey from the CUNY Graduate School of Public Health and Health Policy found that 29% of households in New York City report at least one person having lost their job due to COVID-19. Out of those households, 41% were Latinx, Hispanic community members, 34% were making less than $50,000 annually, and 32% had no college degree. Small business owners, especially those of color, will have a tougher road to recovery due to existing difficulties around receiving business funding and limited financial backing from friends and family compared to their white counterparts. It's clear to see that the consequences of COVID-19 will be community challenges. No single entity or group can fix this complexity. They will require engaging local government, residents, nonprofit sector, philanthropy, faith community, and business community to answer and come up with some critical questions and then test out new and proven ways of problem solving locally. All of this is going to need to be done with a tailored approach to local context, viewing the vulnerable groups as having agency and insight, and taking factors like race, ability, gender expression, and socioeconomic status, just to name a few, into account into our approaches moving forward. So once again, welcome to today's virtual panel discussion. We are extremely proud that you are here. And so let's go over the agenda. Talia, over to you.
Thanks, Nicola. In today's panel, we'll spend the first hour in our discussion. Again, you may type questions at any time into the question pane and we'll collect those. We'll have 20 to 30 minutes for a Q&A with our panelists, and we invite you, the participants, to share your relevant experiences and ideas as well. And then we'll wrap up. As Nicola mentioned, local governments are among those on the front lines, and now more than ever are relying on their networks for support. Our hope for you today is that you would gain ideas and examples of ways to address the needs of vulnerable populations on the local level amidst the COVID-19 outbreak.
So today we have six panelists that are before you representing city government as well as civic engagement leaders committed to supporting cities in this work. Right now, I'd like to go over their names and who they're associated with. We have Kim Lucas. Hi, Kim. She is the Director of Civic Research and Innovation and MetroLab Network. Next, we have Andrés Mantilla. Hi, Andrés. He's the Director of Department of Neighborhoods at City of Seattle, Washington. Next, we have Zach Markovits. He's the Director of City Progress at What Works Cities. Hi, Zach. We have Cooper Martin, Director of Sustainability and Solutions at National League of Cities Center for City Solutions. Hi, Cooper. Noel Nix, he's the Deputy Director of Intergovernmental Relations and Community Engagement for the City of St. Paul, Minneapolis. Hi, Noel. And Jean Setzfend, she's the Senior Vice President for Programs at AARP. Hi, everyone, and welcome. To see more information about this tremendous group of individuals, please download the Cities of Service panel handout, which will also include the list of resources they've graciously prepared for you all. So without further ado, let's get into this conversation, shall we? So some background information for the participants on the virtual panel. We offered our panelists a list of 4 questions to respond to prior to this virtual panel. So we're going to be using their answers to help curate some of this content. Due to the breadth and depth of COVID-19, we're not going to be able to cover and explore all the nuances of this crisis. Instead, we will hit on hopefully some key elements, and we hope that this virtual panel is a catalyst for ongoing practical learning about centering vulnerable populations within this response and recovery planning and moving forward at a local level. Attendees, continue asking your questions throughout. Talia will be organizing your questions on the back end, and around 1 p.m. Eastern, we're going to start the Q&A portion. More on that a little later. Panelists, as a reminder, when you are called after a question is asked, please answer it within the 5-minute time frame. We know that there is a lot of context you'll want to share. So just again, as a reminder, just trust the Q&A portion. If somebody doesn't understand something or would like more context, they can ask that question. And we are going to continue muting and unmuting you unless you do it yourself to reduce background noise. With all that said, let's get started with our first question. So our first question is this. What actions are cities taking to mitigate burdens, share up-to-date information and available resources with vulnerable populations throughout the cities that you work in or work with? And to get us started, I'm going to call on Noel. And if you could highlight some work that you're doing around food insecurity and how that is taking shape both structurally and to also reach different vulnerable populations. Noel, I think you are self-muted, so if you unmute, you should be able to participate. There we go.
Can you hear me now?
Yes.
Great. Well, thanks for having me, Nicola, and really great to be a part of this conversation at a critical time for our country and for local communities. In St. Paul, one of the main things that we've tried to zero in on is food insecurity. We are working very, very closely with Ramsey County, and in fact, our county has taken the lead in forming an intergovernmental working group that is comprised of representatives from our city departments, as well as county departments, and as well as state representation, to really, as rapidly as we can, understand and share, pool information on what the food insecurity landscape looks like, touch base with local organizations and community members on the ground to get a clear picture of the landscape of need, and begin to rapidly scale up responses to fill in where there are gaps. And one of the main gaps that we're finding, like many cities across the country, is that our local food shelves are seeing increased demand for their services, are needing to change the way that they're delivering those services, but at the same time seeing a drop in the number of volunteers that they're seeing coming through the doors. And so what we have really been able to sleuth out is that the city is in a prime position to be a volunteer broker at this critical time. So working with our neighborhood associations, working with other community organizations on the ground, we're working to tap into their volunteer capacity, because we're hearing from them that folks are coming out of the woodwork and saying, what can I do? How can I help? But those civic organizations aren't necessarily finding opportunities. And so we're able to work to identify those opportunities to connect with organizations that are meeting basic needs and directly connect volunteers to those opportunities. So playing that matchmaker role. We are in the final stages of really sort of calibrating our message around that, because we want to make sure folks are doing that safely and in ways that aren't going to contribute to spread of COVID. But we're really excited to really sort of rapidly flesh out this new role for our local government in a way that we haven't seen before. Another thing I mentioned really briefly is that necessity being the mother of invention, our team in HR and in the mayor's office was able to rapidly set up the city's first dedicated language line. So for a city of about 300,000 with a pre-COVID budget of about 650 million, that was huge in terms of meeting a need that's been there for a while, in terms of being able to provide information in language in real time. And so we do have a language line set up now that can provide information in the top 5 languages that are spoken in St. Paul. So moving forward, we're really going to be looking at ways to bridge the digital divide when it comes to sharing information. And so looking to work with our community organizations on the ground and the volunteers that we're touching base with to fill that gap.
Wonderful. Thank you, Noel. Andrés, you also have a similar connection to food, but also prescription medication delivery. Would you mind sharing with folks some information around your food voucher program, the prescription delivery and meal delivery, especially the mechanisms you're using to get this out to folks that need it, and who you're targeting specifically?
Right. Well, thank you, and good morning still from Seattle over here. We've been really organized around some of those similar basic needs, one of which is the food access, and really targeting and focusing on seniors in particular and vulnerable populations who either can't go get their meals or can't go get their prescriptions. And so we're using it as a bit of a workforce redeployment strategy. So if we're out of work, either like restaurant workers or gig workers, Uber, Lyft drivers that couldn't, that are seeing their business go down, we're really trying to work in partnership to shift over their services to help deliver some of these meals or deliver some of these prescriptions, and working with statewide pharmacy association and other labor unions, et cetera, to accomplish that. But it really depends on the partnership that we have with community organizations, and to make sure that government is seen as a trusted advocate in this time, and not some, handing over your prescription as an example, or even handing over some of your food requirements is a personal, private thing. And so really working with our community-based organizations to do that because they're the ones that hold the relationships. We also have a program called the Community Liaison Program, and this is where it's based on a trusted advocate model, where we actually pay community members, trusted advocates in the community, as consultants to help us, and they do their work in language and culturally appropriate outreach. And so in Seattle right now, we have about 20 community liaisons who are working within this COVID-19 space specifically. The program as a whole has about 80 community liaisons working across like 30 to 40 languages. And the idea there is that community organizations and community folks are going to be much more trusted than government. And so we're really trying to meet the needs of seniors specifically where they're at. That also leads into our social cohesion campaign. We don't try to use the word social distancing a lot because it talks about social isolation, or it's interpreted as social isolation. And so for seniors specifically that need that interaction for that service or to go out and do that walk, it's really limiting. And so our social cohesion campaign called Seattle Together helps kind of bridge that digital divide that Noel was talking about, and some of these other services. And a lot of these ideas are coming from community that we then just help operationalize and give at least some resource to in the front end. So that we're being nimble as a government.
Fantastic. Thank you for that. Jean, I'd love to jump and open the space for you to share some things that from the AARP's perspective, what you're seeing local governments do around this question, especially because 50 plus has been mentioned multiple times now between the two panelists. And Jean, it looks like you are muted on your own. There we go. We should be able to hear you now.
Can you hear me better now?
Yes, there you are. Welcome. Oh, you're gone again. We'll jump back to Jean. Oh, Jean, can you hear us okay now?
I can hear you. Can you hear me?
Yes, we can hear you.
Okay, perfect. So thank you again for having AARP here to discuss the older adults. First of all, thank you so much to the cities who are doing so much on behalf of your older residents. Seattle, Andrés, I think you've done amazing work. And I think you're holding an example for so many other cities, as is Noel as well. So for AARP, for those of you who don't know who we are, we're a membership organization with mainly a mission. Our mission is really easy to understand. It's twofold. We're here to fight for the rights of 50 plus Americans, and we're also here to equip them with resources to live their best lives. Right now, in terms of where we are with COVID, living their best life right now is very basic. So in many ways, I think what we're trying to do, kind of echoing what Noel said, what Andrés said, is to basically be an interface for our members as well as the resources that are out there. And with sort of the fast-paced changes that are occurring, what we're trying to do at the federal, national level, all the way down to the state and local level, is to be that exchange of the real source of information to a connection with our older adults who are definitely more at risk during this time. And there's a lot of confusion, and through that confusion, I think wary of where to get the information. So what we're trying to do more than anything else is to bring the information to our members as well as all 50 plus Americans. We've been publishing sort of real time through our online mechanisms of our channel at aarp.org /coronavirus, bring them up-to-date information about what's available. We're trying to also bring the source of information from, again, federal experts to state experts to local experts to the homes within our member space. A lot of this is done through, again, what we call teletown halls. A lot of our members are sort of homebound at this point, and we're reaching them through the phone lines and providing this information to them through that mechanism, as a complementary way of all the cities who are actually bringing food as well as resources, medication to their doorsteps. Beyond that, I think what we're trying to do is continue to fight for them at the national level, to the state and local level. And more than anything else before, in terms of the space that we're in, so many things are changing so rapidly that we are trying to ensure that our members are hearing directly from the leaders, not only about the changes, but then the implementation of the changes. So the more that we can continue to fight for both the health security for our members through changes like telemedicine, telehealth, giving more access to especially Medicare beneficiaries and getting safe health supports through this time, to from the economic space of ensuring that people are getting direct payments, not just sort of tax credits. So the stimulus checks, we really fought long and hard for the direct payment to all individuals at this point in time, to more resources through the Older Americans Act for more Meals on Wheels and other programs like that, and more funding both at the state and local levels. So much of it, I think what we want to do is to ensure that what all the cities are doing, we want to bring more voice to all of you. So the more that we can give you our resources through our platform of content, information, programming, we want to be there for you. We, on a weekly basis, host a teletown hall where we actually reach roughly about 100,000 across the nation. We're also replicating that because we have the infrastructure across the state and local levels of several localized teletown halls. So if anybody wants to get access to these resources, feel free to reach out either through Cities of Service or directly to me. You have my name there. It's my first initial, last name at aarp.org. Just reach out. We will make our resources available to you to reach our members. So thanks for this opportunity.
Of course, thank you. And this is just a great example of how cities can partner with established organizations, both national, but also more local organizations that specifically serve a very particular population and are experts within that space. AARP
Nicola, I think I'm turning this back to you.
Yes. Thank you. So it's just a great example of AARP being a wonderful partner with us and with one of our programs, and now being able to be in front of you all to share their wisdom. So yes, please reach out to Jean, and we're happy to make those connections as well. Jean had mentioned a lot about information sharing, and I'd love to hear from Cooper now, because Cooper has some really interesting examples from cities of how they're reaching multilingual populations, how some cities are addressing the lack of access to internet, and also loan assistance and ASL. So Cooper, could you please share some of these examples with the group?
Yeah, thank you very much. And that's a great transition. AARP has been a partner of ours with the National League of Cities for about a year now, and I'm sure we're working on ways that we can continue to evolve that partnership right now. The National League of Cities, also for those of you on the line who don't know, is a member association as well. We represent local elected officials in cities, towns, and villages throughout the United States. And we have about 2,400 member cities nationwide. We also have a network of state municipal leagues. All of the states have state leagues of municipalities or leagues of cities who are members of us. And so we have a broad reach to local elected officials around the country. Specific examples that we've been seeing for cities to do outreach and mitigate some of the burdens on vulnerable communities. You've heard several examples, doing outreach in multilingual outreach in St. Paul. There's a number of other cities who are doing that. San Diego has developed new posters in 10 different languages. There's a lot of census language that's going out there. I know we as an organization have put out new census language in 11 different languages to continue with census outreach efforts and to get the population count where it needs to be, because that's continuing and cities are involved in all of that. In El Paso, not just multilingual, but addressing the digital divide, trying to make sure that people who don't have high-speed internet access at home are still able to participate in school, or still able to participate in some aspect of society. Cities like El Paso have set up hotlines to start identifying those communities and conducting direct outreach to individual households who need better connection in order to just have their students be in school. And then you mentioned, Nicola, the ASL. I know there's a series of videos that have been, for lack of a better word, translated so that they're not just audio recordings and things like that, but video recordings that include sign language to get critical information out to communities. We could continue going through examples probably for the next 90 minutes while we're on this line, but one of the things that we as an organization have done that I'll point out is the best resource we have is all being compiled at covid19.nlc.org. Just last week, we stood up a new landing page with resources that are being developed by staff throughout the organization to target immigrant-rich cities, cities that have significant immigrant populations, to target homeless populations, people who are experiencing homelessness or are on the verge of homelessness as a result of this. Specific information and recommendations and examples, in addition to what I mentioned from El Paso on the digital divide. We've also stood up a new local action tracker. A lot of this data is still being cleaned, but our goal with this is to have vetted and action-focused information that cities can look to. What are the executive orders, the council actions, the ordinances that are being passed, with links to the actual language and the city websites, not just news coverage of those actions. So we have about 800, just shy of 800 actions up there right now that you can scroll through. You can look at targeted populations. You can look at the type of action that's being taken, whether it affects government operations or housing or utilities. One thing that hasn't been mentioned here that's helping a lot of workers who have been deemed essential or workers who can't work remotely is transit. Is being made free in a lot of jurisdictions, both at the county and city level, to allow people to continue to access the city and have mobility options where they need to. And as an organization, we're doing that analysis, we're putting together that tracker, but crucially, we're also working in advocacy. Cities are expending a lot of resources right now, and we know that the revenues are going to be coming down. So you're increasing your budget, you're decreasing your revenues, and cities can't maintain structural deficits the way the federal government has. So as an organization, really focusing on the resources that states and the federal level can be providing to cities, so that we as municipalities can be the ones on the ground working with residents and providing these kinds of services, but that we have the financial tools and funding and support from other levels of government that we need to continue this work for what's going to be several more months. And I think I'll pause there, and we'll get into more specific questions and other things as the webinar continues. Thanks.
Awesome. Thank you, Cooper. Zach, I'd like to jump to you because we haven't really talked about small businesses yet. And I know that you have some interesting examples of how small businesses are being supported by local, by city governments.
Sure. You guys can hear me okay?
Yes.
Great. So, hi, thank you guys for having me on. Big fan of Cities of Service. And again, I'm Zach Markovits from What Works Cities. For those of you who don't know, What Works Cities is one of the largest philanthropic initiatives working with city governments to help better leverage data and evidence to drive decision-making with the goal of improving the lives of residents in everybody's community. And there is not a time now more that where data has really come to the forefront, and how evidence of what works is really of critical importance to help streamline response and make sure that as we move from response into recovery, cities are able to do whatever they can to serve all their residents, and especially the most vulnerable populations. Before I jump into small business, I just want to echo something Cooper had said and encourage you all to go to the tracker that they have thrown up there. We've been pushing all of our partners there and have been actively loading information in there. It's a great resource for you all to sort of see what's happening across the country, and would encourage you guys to dive in. One thing we've been doing at Work Cities is since we have a network of over 200 cities that have been actively working with us over the last 5 years, is helping to kind of field questions and respond at what's sort of critical and what's at the forefront right now. We don't necessarily know what is best practices right now, but at least understanding what practices are and then seeing how that iteration is happening over time, innovation based on the data that cities are collecting, and finding that sort of rapid innovation and the opportunity to share that out is of critical importance. So in the resource bank, you'll see a list of city-specific targeted tracker that may be valuable for you all. And I think all cities are challenged with what data to use and how to identify vulnerable population. It all starts with data, iterating on that, and we'll sort of come back to that. One thing, and Nicola, to sort of to your question specifically, that we've heard a lot from cities on the more recent basis has been what are the best practices, or even just the practices on small business, on business recovery funds and the like. And this is so important, especially for low-wage workers. In March, according to one survey, more than 2/3 of low-wage workers have found themselves working less, with more than 40% experiencing layoffs, and that will increase in the short term at the very least. Federally, I think everybody knows there's a number of programs that are offered in the $2 trillion stimulus fund, including about $350 billion in the payroll protection program that is aimed specifically at helping small businesses continue to make payroll. We know that this has been really hard for small business to apply, and that early indications that this will ultimately be insufficient to meet the overall need that's going to be happening across the country. And so many cities have been asking, so how do we go from sort of now to whenever those dollars come out, right? I mean, local businesses are hurting now. And so how do we make sure that our women and minority-owned business and vulnerable populations are able to access funds on the more immediate side? And so there's been some really interesting and innovative work happening across the country. Many of folks on this panel can know a lot about it. In some cases, there's cities who are offering sort of more immediate no interest emergency loan programs. Birmingham, Alabama has been offering emergency loans through their Birmingham Strong initiatives, sort of loans from $10,000 to $25,000. Syracuse, similarly, through their Economic Development Corp. You also see cities doing sort of cash grants. Denver, a good example there, grants up to $7,500 as part of their economic development emergency relief program. You also see some cities scaling this, right? Look really to making sure they occupy each space in this matter, focusing on, so Philly, for example, having a micro enterprise grant that is grants up to $5,000 for businesses with revenue less than $500,000. But then also looking at that next level up, both small business grants and interest loans with grants up to $25,000 for businesses that are $500K to $3 million in revenue. And then for that similar bank, you can have loans up to $100,000 to really target that. And then as we're thinking about sort of the workers in the situation, which I think are really important, I think New York City's employee retention grant program has been really interesting, focusing on businesses with fewer than 5 employees, and seeing if they can, or offering up to $27,000 to cover payroll costs for a couple months. So the opportunity to sort of think about new ways to leverage the different pieces of the small business pie has been quite interesting, and I think what we'll see over the next few months is what is the impact of that going to look like. One actual question I have for either the panel or for the group on the phone right now, which we can maybe answer towards the Q&A side, is about the informal businesses. As we think about vulnerable populations, how are cities looking to meet businesses that don't have a traditional storefront, right? They're selling in salons, they're selling in people's homes, selling goods sort of to stores. People or businesses that rely on fairs or markets that would traditionally start up in the spring. Businesses that are largely cash-based, right? Individuals who probably should be reporting everything, but unfortunately did not. And so what does that look like in terms of their ability to be recouping some of their expenses? How do we think, because this dovetails so strongly with individuals who are un or underbanked, which I know Cities for Financial Empowerment Fund is doing a ton of work on, how does that look, and what are the policies that we can do to really focusing at that local level to individuals that are probably hurting the most among us?
Yeah. No, that's a really good question. So thank you for, first of all, sharing all the information and examples. And that question we'll circle back to at Q&A. We'd now like to jump to our next question, realizing that we are at 12:38. So the next question has to do with partnerships. And what we wanted to know is what sort of partnerships seem to be working or are in the works that help cities respond to both immediate and midterm needs of specific vulnerable populations. And Kim, you had some really interesting examples of how universities are partnering with cities to provide some resources, but you also posed some really interesting potential for researchers, for universities to plug in for the longer term recovery. Kim, would you mind sharing some of your wisdom with us?
Yeah, sure. And just want to say thank you for having MetroLab Network on this panel. We're so excited to talk about this, and mostly because I think this may be valuable to folks who are attending, and thanks to my fellow panelists and also any of the attendees who are out there doing direct service work with folks and thinking about these things. I think this is really important, and glad that you're spending 90 minutes with us today. I think a lot of MetroLab's work is really about partnership between what local government looks like and institutions of knowledge, so colleges and universities that might be situated in or around various cities or various towns across America and actually globally. And so we often think about what can these kinds of institutions do together? What can we leverage in terms of everyone's expertise to produce really good things for the community? And how do we listen and to our communities and hear what issues are arising so that we can partner and kind of leverage all of our resources to benefit everyone. Many of our member institutions have been very, very focused on thinking about their own vulnerable populations, particularly low income and first-gen college students, international students right now especially, and really thinking about how to support folks and especially supporting folks who see campus as a place of safety or stability or a place where they get many of their resources. But we do have some member institutions and some examples of even non-member institutions that are doing things beyond their own campus community. Some of those have looked like really rapid response for first responders. So for example, MIT has kind of gone and done a collection and sweep of its labs to understand if there are any PPEs or any equipment that can be donated locally to first responders. We've heard of colleges and universities, so Tufts University, Middlebury College, and NYU, thinking about how to use their space for additional hospital space, particularly the dorms that are not being used right now. So that's another interesting idea. And speaking of space, in my own home city, the city of Boston has entered into a partnership with a local organization working with people who are homeless. That's the Pine Street Inn, as well as Suffolk University, to use Suffolk space as place of shelter temporarily for folks who are experiencing homelessness. And so we're seeing these kinds of different things kind of bubble up. Beyond, like both within our member institutions, but even beyond our member institutions into these kinds of city-university partnerships. That's in the short term.
In the midterm, one thing that we can see from these institutions is, institutions have assets. They have lots of expertise, oftentimes, can really think about problems from different angles and different ways. They also have sometimes resources and sometimes space, as we've seen in the immediate reactions. And one of the things that colleges and universities offer is the time and space to really think through problems. Right now, we're understanding that there are many gaps in many of the systems that we have in place. And there are places where we haven't done maybe the most efficient or the most beneficial things for the people in our communities. And so as we realize and recognize these things, I think one of the things that we can do is surface these gaps and ask folks who are experts from our college and universities, inclusive of researchers, but we're talking also about staff members and students, to really help think through really new and innovative ways of figuring out like new solutions to these problems. So for example, one of the things that folks might be able to help on are thinking through, like, what does operations look like? What does a system look like in a local city or town? And how do we improve on those operations? How do we coordinate and do that response? Another thing that we could potentially think of is, as we move into recovery, from response to recovery, how do we think about these things that we might need to think about at scale that we haven't yet done? For example, we're experiencing a mass collective trauma. How do we address that on a city scale, on a town scale, on a county scale? And these are things that folks can start thinking about now. If we knew what the issues were immediately on the ground, we can begin to think about these things while we have a month or so of time to really plan and think through these things. And lastly, I think, this offers, and this is a very interesting idea, I think this offers some space to think about, okay, there are some response things that have happened in various cities. How do we take these responses and understand what they mean for cities who are not in crisis, right? At the point in time, hopefully when we're not in crisis, can we look at these things that we've created in response and say, can we use these moving forward? I'll give the example. There are some cities across the globe, Minneapolis, New York City has done this, Calgary has done this, that have taken parts of their cities and opened up streets and opened up open space for people to use so that they can have more space to socially distance but can still go outside. Are these things that we've done in these cities in response things that we should maybe consider moving forward when we're in a post-coronavirus world? And so these are kinds of things that I think in the midterm, these kinds of city and university partnerships can begin to tease out, can begin to have conversations around. At MetroLab, some of the things that we're doing to support these things, we've kind of come up with some kitchen table talks, as we're calling them, which is an opportunity for a small group of local government folks, academics, researchers, and community members to sit around and talk about a topic of interest so that we can begin to seed these ideas and share these ideas around. And we've also pulled together our own resource guide. I'm sure there's plenty of them roaming around, but particularly for local governments and academics who are thinking about how to do these partnerships. I think these are the kinds of things that we can support at this point in time.
Beautiful. No, these are extremely important questions. And like you said, it's just another example of an asset that many of our cities have. And so between AARP, your local community, universities, public colleges, and other affinity groups, there are great things to surround. These are great assets to surround yourself with to understand the issues right now and share information, but also to Kim's point, think about future and future planning that needs to happen. We do have 15 or so minutes left for this portion, and I want to make sure that we also touch base on the last question, which has to do with volunteerism. But before we jump into that question, I would love for Zach to talk a little more about this interesting concept of how cities are iterating, right? They're trying something new to respond to a need in partnership with another entity, but then using data to adjust what they're doing. Zach, if you could share an example, I think you mentioned there was a Dayton example with us, or any other you've come up with in 5 minutes or less, that would be awesome.
Sure. Sure, I'll keep it tight and can go into more examples if we do. I mean, I think that's a really good point. And, I think performance management is really important right now, and data and how you use it can enable partnerships in a way that can help that coordination and enable partnerships, and stakeholders can do a lot more. So, Andrés, Seattle and King County, the data that you guys have pulled together, both your county dashboard, but also this COVID-19 vulnerable communities data tool is extremely helpful, and you can show how data can align people and stakeholders in a useful and engaging way. Another example, and we've heard and we've seen so many cities taking that really tough decision to close schools, right, and preschools, right, and this idea of offering free meals as a way to individuals through that schools. It's a hard decision in kind of every circumstance, because so many children get not just one meal, but 3 meals through their primary education, and actually making that available is really, really hard. And what we've seen is that one study has found that most low-wage workers in cities, although they were eligible to pick up free kind of grab-and-go meals at schools, about 1 in 10 actually receive them. And so understanding that, like, the first thing to do is actually get that out there, right? Like, we need to make sure that we're getting meals out there. That's the practice. But then finding ways to kind of iterate on it. And so in Philly, for example, they similarly did some like pickup lunches during the day at rec centers and community places. But you then recognize that like no one is showing up in certain places, because in certain places the need is deep, in certain places shallow. And so how do you then take the data you're collecting, bring it back, and then iterate on that model in a way that allows you to make sure you're doing more? So modifying the sites, modifying the hours. Now individuals there can get up to 6 meals per visit, so that you're isolating the visits. They're now actively putting them in public housing sites, or starting to do that, so that you're making sure where the need is deep, you're doing that again. In Baltimore, there's similarly, they're working with Esri, their existing kind of partnership, technical partnership, to develop a tool by which like all of their food partners, so Maryland Food Bank, Meals on Wheels, are kind of reporting the meals served at their locations, so they can understand where the potential gaps are across the city in a way that enables them, and actually by them I mean enables their partnership and their stakeholders to do more. The Dayton example that you had mentioned, I think is really interesting. At What Works Cities, we've been working with 9 cities for the last year on helping to reverse the decline of economic mobility that we're seeing in many of these communities nationwide, but in these specifically communities. And we're sitting in a city like Dayton, which have been leaning on Preschool Promise, which is their major preschool initiative, an pretty incredible program, who's now moved to virtual. So in addition to trying to figure out how they are working to enable virtual preschool opportunities to the sort of neediest and the most vulnerable communities there, they're also working with the city on sort of meal delivery, and how do we think about getting individual meals to those residents and to those children where they need it the most. And so leveraging those existing partnerships, right, the ones that go real deep within your cities, asking what do you need, and how can we sort of share data back and forth to enable you to do more, to do the actual service delivery when it comes to it. At these times of crisis is one of the most challenging things, but also one of the more exciting things we're seeing in the best practice situation.
Wonderful. Thank you for that. I think the next question we want to jump into is the role of volunteerism in this response. So the question is, how are cities using volunteers to meet the immediate and upcoming needs of specific vulnerable groups? And I'd love to kick it off with either Andrés or Noel. If you could speak to, I know you mentioned the food vulnerability piece, the food access piece, but what are some other ways that you all are leveraging volunteers now and are planning to?
So we're thinking about using volunteers to really get over that digital divide. I think one thing that came up in conversation with our neighborhood associations the other day is the idea that, folks can contactlessly get flyers out with information, by don't put it in the door, right? Because if someone's not going outside, they might not see it, but, use masking tape to tape it to the window. so that they know that there's been an attempt to try to share information on our language line, as well as on the other resources that are available online. But if you don't have internet access, you aren't able to get access to. Another thing that we're seeing a lot of is mask making at home. We have a local yarn shop that is contactlessly giving out kits for folks to make face coverings. Seeing the business community sort of step up and provide, the resources that are needed for folks to be able to volunteer from home, which is, another big thing that we're hearing is there are folks who, were retired or, otherwise had free time that are now at-risk populations, and so trying to stay home. And so, we're continuing to try to source things like mask making, things like joining some of the pop-up mutual aid networks that are forming to allow folks to continue to be a part of the solution and continue to be connected to community from home. And I would be remiss if I, in terms of our efforts, if I didn't give a shout out to Cities of Service. It really was the fact that Cities of Service grant funded the city of St. Paul to begin to explore how to use volunteers in a different way before we were in the COVID crisis, that had positioned us to really think about how to rapidly repurpose our initial proposal to really leverage volunteers and play a central role in leveraging volunteers as part of COVID response. So I think that type of philanthropic and intermediary support is only going to become more important as cities are continue to try to get creative and rapidly deploy solutions to conditions that are evolving on the ground as we continue through the emergency and as we head into recovery. Cities are just really positioned to be a leverage point with philanthropic partners to really try to take efforts to scale in partnership with local organizations on the ground.
Thank you for that. Others that have examples of volunteers being used strategically currently to meet needs of vulnerable populations, or what you're putting in place to be able to do that down the road?
I mean, I'll just second what Noel said, and just add that one of the most strategic ways we've been using community members as volunteers is to actually share accurate information out in a world where social media is pushing out all sorts of things that that are frankly hurtful, especially to vulnerable populations, whether it be healthcare information, whether it be information about how and when to go get food. We've been really activating our network of community volunteers through our community hubs program to push out accurate information to those populations. That's part of our social cohesion campaign I talked about earlier, Seattle Together. But that is maybe something that wasn't as obvious to us in the beginning. Is this kind of how do we prevent the spread of rumors, essentially? And so we've been really partnering with the county and with the state to try to amplify that, so that we're not spreading different types of information out, and so that we're consistent in our message.
Perfect. Any other examples around volunteerism being used, or even partnerships that you've seen be effective in meeting immediate needs or future needs of vulnerable populations? And this can go to anyone. Jean, anyone can take this one.
All right, I think I've finally unmuted. Can you guys hear me?
Yes, we can hear you.
All right, so building on the good thoughts from both Noel and Andrés around volunteers, I just have a couple of sort of examples to shout out based on what we're seeing. First of all, around the mutual aid groups, I think those are tremendous resources that are popping up all over the country. And one of the things that AARP is trying to do is actually identify them across the nation. So one of the resources that we have in the resource folder that you have is Community Connections, which is trying to highlight across the country all the mutual aid groups. In addition to that, one of the things that we have on that site is also a Friendly Voice volunteer effort where we are, again, making calls to more homebound seniors just to check in on folks, understand their needs, and just be a friendly voice, quite frankly. Beyond that, we're actually seeing a lot of cities take advantage of that mechanism through volunteers as well. Boston, through their Department of Aging, is reaching out to their residents, which is amazing. From big cities to smaller cities, I think Grayson County in Virginia is also doing that as well. So those are, I think, important aspects. Andrés also picked up on the whole notion of misinformation, disinformation in this terrible time. And unfortunately, there are bad actors out there taking advantage of people, even in this time of crisis. So we actually have a volunteer supported helpline, the Fraud Watch Network helpline, which is providing people support through this time, just even validating what's out there. Is this information I'm getting correct or not? And we want to extend that resource to folks as well. If you go to aarp.org/Fraud Watch Network, you'll be able to get information there. And also we have, again, the helpline, which is 877-908-3360. We'll send this information out so you don't have to take the notes right now. Last but not least, in terms of some interesting thing that we're seeing in rural communities where volunteers are stepping up. In Maine, we have probably the most organized network of age-friendly communities. And one such smaller town, you've heard of free libraries. They actually have now free pantries being set up across their community where they're stocking in certain locations resources for community folks who are having a harder time getting access to food shelter. So neighborhoods or neighbors in their neighborhoods are coming together and bringing food and resources, toilet paper, quite frankly, and setting up these sort of community pantries, which is just amazing. So those are a couple of different ways that people are just coming together and helping their neighbors as well as their communities.
Beautiful, thank you. So practical and with limited resources can be initiated. Zach, you mentioned that you had a few examples as well. Let's get those out there.
Yeah, I'll get them really quickly. So one, a number of people have brought up this idea of sort of getting accurate information out there, which I think is really important. Our colleagues at the Behavioral Insights team have been working in the UK, but locally as well, doing testing on what works for communications and messaging. There's in the handful of resources and bios, there's a link to a number of their blog posts that are worth following along and sort of seeing how you can sort of make sure you're communicating the most efficacious way you possibly can. About hand washing, about wearing masks, about the sort of the behaviors you want your residents to sort of to embody, and doing it in a way that is going to meet people where they are. Not everyone's going to hear the message in the same way. So I think that's sort of really important. We've also been just really excited to sort of follow along as different cities are sort of looking at engaging volunteers in different ways. A couple of really interesting examples. Gilbert, Arizona has developed sort of a searchable map of small businesses, to bring up to my earlier point about the ways that that individuals in the communities can kind of support those businesses. Kim, in your native Boston, their Boston Resiliency Fund is helping kind of coordinate the fundraising efforts, right, around how to help those most affected by coronavirus. And so using that the pulpit in a way to bring those fundraising efforts together to distribute in the way that's really critical. And then in Louisville, and to the mental health point, I think that Kim, you had brought up earlier, they've launched a program called Lift Up Lou, which is a social connection program to help kind of keep residents' spirits up during this time. And how do you sort of, again, use that meeting and the convener power that a city can really have to bring people together and to make sure that we're attentive to all types of health that people are suffering with at this time.
That is so important, and it's such a real reality. And I think Noel, you're going to have the last word before we open it up to questions from the participants. And you wanted to kind of talk to Kim's mass trauma point. You had something to share, which I think nicely dovetails from what was just expressed by Zach.
Yeah, I think that was a really good point, and it's a reminder of some of the conversations that we've had internally at the City of St. Paul about how do we recover as a community. And one thing that we're looking at that we used as part of our efforts to address public safety concerns last fall, we worked with a local nonprofit called the Dispute Resolution Center to really take a talking circle approach. To really sort of dig into, public safety being a mass trauma, being a highly charged topic, really get folks not just sort of talking to their elected leaders, but talking to city staff, talking to each other, more importantly, and having what our mayor calls three-dimensional conversations about complex issues. And so we're already looking at and thinking about, what are the ways that we can not just maintain social cohesion through the crisis, but it's not too early to begin thinking about what are the tools that we're going to need to deploy in terms of reweaving the community once we're into recovery.
Mm-hmm. Very important. So at this point, we want to extend a tremendous thank you to the panelists for all the prep work you've done to be ready for this conversation and for sharing your wisdom and taking time to do so. We're going to turn over to some questions from the participants. And one of the questions that has come up is, we know that intersectionality is real, right? You might have somebody who is of a certain age, but also has a certain racial background or a certain other identifier that might make them a more vulnerable group during this particular crisis. And so the question here is, what are some of the best ways you've seen cities provide services to multiple people? So what are the best ways to coordinate multiple services to people in your city? How are you coordinating these responses? And yes, go for it. I was just about to call on you, sir.
Okay, great. I think first and foremost, from my perspective, and this is a kind of a self-serving perspective as somebody who does outreach and engagement, is that outreach and engagement in how you communicate with the folks can't be an implementation exercise. In this crisis, it has to be a core centralized planning and policy exercise, because more than anything, to speak to intersectionality, folks in our field are able to see how everything relates to everything more than somebody who's just planning to implement like a certain widget or a certain loan product or a certain program. And so really elevating the role of outreach and engagement is a key. And then, what we've realized is that everybody needs to eat. Everybody has a rent that's due. Everybody needs a job. Everybody needs to take care of either themselves, their family members, or other vulnerable populations. So what we need to do is to both highlight and solve for them, but not to treat those individuals any differently in terms of what we're planning to provide them for services. But we're starting with them as part of our race and social justice initiative at the City of Seattle. We attempt to lead with race, and by solving for those vulnerable populations that have intersectional needs, we are actually solving for the broader community. But I think the key aspect is, if you are being brought in as just a implementer to like, hey, this decision's been done, now go sell it to community or go work with this population, you're not going to be successful, because you need to be I feel at the central point so that you can see how all of these connections are happening, so that if somebody needs food access, they are on a voucher or on something else, they also probably have lost their job maybe, and so they need job relief and rent relief, and so those connections are essential.
Thank you. Anyone else from the panel wants to share their approach to coordinating or what they've seen in terms of service coordination?
Yeah, and similar to what Andrés is talking about, the thing that we've seen is coordination of these services under some sort of umbrella. And both what Oakland in California has done and Richmond in Virginia has done is use their community foundation to start acting as a hub for vulnerable populations writ large. In Oakland, the first donation to the Oakland Fund was related to seniors, but they've now got over $2.5 million for the range of vulnerable populations that they're trying to provide a range of services to. And I think several other cities are pursuing that kind of approach based on the tracker information that we've seen coming in.
Thank you for that. I would like to see if there are 1 or 2 comments from attendees that are interested in sharing how your city is coordinating these services for this during this crisis. If you want to raise your hand, we'll unmute you. And if not, we'll move on to the next question. Okay, wait, let's see. I think we might have a hand raised. All right, let's hear from Ava. We're gonna go ahead and unmute you, Ava. You should be live.
Hi, how are you? I am from Albany, New York. I work for the city of Albany, and we have created a mutual aid platform, which is intersectional, and it helps address multiple boundaries in our community. That is food insecurities, cleaning supplies, senior wellness, mental health resources, and work help for students of all ages, even college students, like tutoring. We engage with community members through volunteerism, as well as community leaders and nonprofits to bring our resources together to address these issues. This has been working very well. The only boundary that we have faced has been financial assistance and supporting these initiatives to be able to help the multitudes.
Thank you, Ava. And that's a question we'll get to in a minute around funding. Maybe one more participant that could share how they're coordinating resources as Waldo. We're gonna go ahead and unmute you so that you can share your wisdom with us. You should be able to speak.
Okay, can you hear me?
We can hear you.
Good afternoon, everyone from Buffalo, New York, and thank you to the Cities of Service. We're a proud member of that network, and I see there's some other groups and organizations that we're a part of. This weekend, we actually announced with Mayor Byron Brown the Good Neighbors Network, and what we did is we tapped into the power of volunteerism to do some impact volunteering on our most vulnerable communities. We have a network of, and many of you have block clubs and neighborhood watches that have been part of the social fabric of a city that have kind of self-organized. And so we had a network of them and we worked very closely with them. We also had volunteers, and in this opportunity, we wanted to see what we can do. And so we have volunteers going door to door using a door knocker with information because there are some communities that may not necessarily have the opportunity to be on social media or to get the news, and so there's important numbers. But what we're asking the block clubs in each one of the communities is to champion what's happening on that block. So if we put a door hanger and they turn it a certain color, we know that there is a need there. Maybe we need to deliver food or medicine. And so we are utilizing data as well to identify our most vulnerable communities with our 311 and our call center. So leveraging the existing processes that we're having within the city of Buffalo, but also tapping in the power of the networks that we're having in the city. And we're having great response. Not only are we having volunteers that are helping neighbors, and we're doing this very socially conscious. We're doing this obviously not exposing the volunteers as well, giving them gloves and hand sanitizers, but just to go and while they're also getting out and walking as well too. So they would see on a door, they would see if, hey, something's not right, that door hanger is still there, or something's not right, or if the person turned the door hanger a certain way, we would then tap into calling 311 and also following up with food pantries, following up with whether or not they need to deliver medicine. Sometimes there are some situations where the city, and we've actually announced this a couple of weeks ago, where water were turned off and we actually turned it back on for them. Obviously needing water to, in this crisis or in this pandemic. So those are some of the things that we're doing in the city of Buffalo.
Wonderful. Thank you, sir. Good to hear your voice.
You too.
Next, there's a question around supporting your service providers, like nonprofits that are actually serving the vulnerable populations, like food banks and other agencies. And most of the time, those agencies aren't necessarily ready and able to respond to such a impactful crisis that we're in right now. And so the question is, how are cities providing financial support to these critical service providers or other supports to help them recover beyond funding or other ways that you've seen cities step up and support these key service providers and partners? We're going to turn it over to our panelists first and then open it up to our participants as well.
Can you guys hear me?
We can hear you.
Okay, just one quick thing. As I mentioned before, the Older Americans Act provides funding from the federal down to local level, and just wanted to make sure everybody is aware of the fact that the Administration for Community Living has expanded funding for a lot of these local services. So that's somewhere to turn to share with local community partners as well as the municipalities is to tap into those resources. I'm sure you've all seen that, but just wanted to make sure that you're all aware.
Thank you. Andrés, you said that you have.
Yeah, one of the things as we respond to this crisis, it's kind of like reimagining the role of government. And the services that might have been important pre this crisis are maybe still important but not prioritized. And so what we've done to kind of, we don't have the ability to kind of fund every service provider. So what we've tried to do is reimagine kind of an internal city work. I mean, we have like 14,000 employees. So an internal city workforce redeployment strategy for those, maybe the community centers and the libraries are closed right now. So what does it mean to kind of reimagine their roles and being able to add staff capacity to some of these food banks, homeless shelters? We know that those workers are also having to deal with the same life realities as well. So that's one resource and creative way of us bringing additional capacity, where the city is still paying for those workers, but we're redeploying them for those services.
Thank you for that. And I think we'll turn it over. Oh, Kim, did you want to say something?
This is not something that has borne out yet, but from the university angle, I've definitely heard of various universities and various folks on the ground trying to figure out what it looks like to open up pathways for different either departments or centers and institutions at universities who were planning events, for example, to take a portion of that budget, which has already been dedicated for FY20, and provide support for local organizations. So the example that I've heard most of is, we were planning this giant conference. How might we create a pathway for folks to be able to donate either our catering budget or a portion of that catering budget to those, places like a local food bank or places like a coordinated fund. And so, again, hasn't been borne out, but it's interesting to hear these ideas kind of bubbling around, at least across different institutions.
Thank you for that. Jean, there's a very specific question for you regarding the helpline. The individual is wondering if in the volunteer calls to seniors, could we refer them to AARP helpline if they do say they need assistance? Is this for all seniors or members only? And we're going to go ahead and unmute you. Go for it.
Sure. So all the work that we do is for everybody. You don't have to be a member to access all of our resources. So the helpline that I mentioned before is the Fraud Watch Network helpline. Let me repeat that number again in case you want to share it. It's 877-908-3360. We also have a call center that takes calls on any aspect. So if you can call our 1-866-OURR-AARP for any number of questions. Last but not least, the Friendly Voices, Friendly Caller a program on the Community Connection platform is also available, and that's at aarpcommunityconnections.org. Again, these are staff and volunteers around the country who are just making friendly calls to folks just to check in for nothing more than just closing the gap and the distance between all of us during this time.
Thank you for that. We want to open it up to our participants. What are some ways that you're seeing your local governments support service providers as partners? And I see that there's a hand for Christina. Christina, I'm going to go ahead and unmute you here, and we would love to hear from you. Christina, can you hear us?
Yes, thank you. I'm in Goodyear, Arizona. It's outside of Phoenix, and we convene a faith and community roundtable. I early on reached out to all of our members of the roundtable via email survey and collected from them how their business operations have changed and what they needed and what they could provide. And then I compiled that into an email to share with the rest of the group, but it also was then posted on our city's COVID page. So we could direct residents who were interested in volunteering or helping or accessing services. And I intend to continue to refresh that since it's such a transitory environment right now. But one thing I heard early on was that some of our nonprofits, our city doesn't deliver any direct human or social services, so we rely very heavily on our nonprofit partners. And I heard early on a barrier to being responsive to the influx of new volunteers was the ability to practice social distancing and still perform background checks, fingerprinting, onboarding. And I was wondering if anyone knew of any solutions to that or if other cities are relaxing their standards. Thank you.
Thank you for that question. We'll keep it in our records and circle back. I think Sadie, you also have an answer to this question. I've unmuted you. How are your local service providers being provided or supported?
Yes, hi, my name is Sadie Diaz with the City of Sunrise. I'm the Public Engagement Manager. So I'll do internal and I'll do external as well. So our internal, what we did with our leisure services department was that we kind of remixed it into a social services department. So the city has built like a compassion and resource and referral call center. It's multilingual staff, so it's French, Creole, Spanish, and English because we have such a diverse community. And it's Mondays through Fridays, 8 through 6, and it's all kind of resources. So it's food resources, mental health, business resources, restaurants, offering takeout and delivery because we still have to support our small businesses and COVID-19 sites. So that's what we're doing internally. And it also keeps our part-time staff fairly busy under these times. And if it's after the 8 to 6 time frame, we still partner with our 211 Broward, and that's a 24/7 helpline. But the compassion and resource and referral call center, it's more for our for anyone to call in, but there's specific resources just for our residents, which is the City of Sunrise. And then additional to that, we've been addressing food insecurities in 4 different ways. We teamed up with Feeding South Florida, and we give out on Mondays and Fridays, we give out boxes of fresh food. So it's, you know, ham, whole chicken, arugula, tomatoes, oranges, apples, orange juice, that sort of thing. And they get a big, you know, again, it's multilingual because our city's so diverse, but, you know, we make sure it's more of a drive-through kind of service. We call it our food concierge service for our residents. And if they need anything, we're here to provide it for them. So we offer 300 meals on Monday, or 300 meal kits on Mondays and 300 meal kits on Wednesdays. And because it's Easter time, we also give activities to the little ones, like the little kids. So we have like an Easter egg hunt, kind of like a mobile type of thing, at home thing. So that's one thing for concerning food insecurity. If there's somebody there, or if somebody has been identified in the city that cannot necessarily go through the drive-through, what we do is we do actual drop-offs at their homes as well. And then we've also teamed up with a local Rotary Club, and what they do, which I think it's, you know, it's pretty, you know, what they do that's pretty amazing is that the city will identify a family that's in need. The family will be able to call a participating Sunrise restaurant, and they can obtain a predetermined amount, whether it's $30, $40, or $50, and then the restaurant will bill the Rotary Club, and they obtain meals that way. So we have kind of like a threefold to like make sure that there isn't food insecurity within our city.
Awesome. Thank you for that. Thank you very much.
You're welcome.
Before we dive into our next question, Tom, you also wanted to share an answer to this point. You should be unmuted now. Tom, can you hear us?
Hello, you're not talking to me, are you?
I am, yes.
Oh, I'm sorry, I was looking at something else. I posted a question regarding local news.
Okay, we'll look into it and we will get back to it.
Yeah, I was interested in getting a cross-section of answers from the panelists and the other participants, because this is a big issue for local news. We are, I think, too preoccupied with our own problems, and we aren't paying enough attention to the communities and their problems, which is what we ought to be doing. And I just wanted to get feedback from all of you folks about that issue.
Thank you for that, Tom. We see your question, and we will definitely be in touch in terms of news stations can be used to further this forward. So thank you for your question and for the follow-up.
And one final thing, Nicola, I'm the guy who sent you the email the other day regarding local news.
Perfect.
If you remember that.
Of course. Thank you for joining the webinar, and we'll be in touch.
Thank you very much.
And the next question that has come up a lot is around volunteer. How are you overcoming volunteer background checks, or how are you streamlining this for our city staff and other folks here that work with cities? What are you seeing in terms of getting background checks done quickly and just kind of streamlining the process of orienting and managing volunteers? Maybe I can start with Noel, because I think you also wanted to do another, make another point as well real quick.
I did, yeah. So one, in terms of volunteer vetting, you know, this is where intergovernmental cooperation really comes into play. So our county sheriff's office has extended an offer to do expedited background checks at no cost to the city to make sure that we are passing along vetted volunteers. So again, you know, look to your intergovernmental partners to find ways to reach across and get that done. And then one thing I wanted to mention to something that Jean said is just the importance of connecting with your local AARP chapters during this time. So through our Experience Matters grant, the City of St. Paul had already started to form a relationship with the Minnesota AARP chapter. And so we've been able to incorporate the work and the resources that they're connected to national AARP into the materials that we're posting and distributing locally. And just the opportunity to tap into their member base as a way to send directed messages and get a sense of needs of your local senior community. So I'd be remiss if I didn't mention that.
Thank you. Other examples of how cities are streamlining background checks and just the whole volunteer management aspect of the response.
Hi.
Go for it.
So similar to what Noel just mentioned, we have a good cooperation with our local police department, but we're really just focusing on, we've actually relaxed a lot of those restrictions. I mean, just in the urgency of now. And just really trying to hear what the community organizations need and trying to just solve quickly and triage. So we're not trying to put up additional barriers to participation. And so the city of Seattle is really kind of functioning more of like a matchmaker. It's almost like a match.com, if you will, around like, this is my skill set and how do we put folks into action quickly. I think where we've truly tried, as I mentioned earlier, is just on that workforce redeployment of our own volunteers. We have already the background checks of all of our employees, so that's a quicker thing for us to mobilize.
Wonderful. Thank you all for these really important this really important conversation, quite frankly, because it's so important to center our vulnerable populations in our overall response. And this has been a great inspiration for us to hear how this is all happening. Before we wrap up, I think, Zach, you wanted to make one last follow-up point, and then we'll end the virtual panel.
Yeah, one just very quick thing following up on what Noel and Andrés are saying is I think at these times of crisis, right, building these bridges between your intergovernmental partners and your stakeholder groups is so important. Even if there was conflict or challenges before this, right, people come together and work hard. And what I would encourage all of our city partners and community partners here who are listening to do is sort of remember the paths that you're blazing right now as we get into recovery mode, and make sure that we're trying to formalize these connections as much as we possibly can. As you're sharing data, like what does that look like, and how can you formalize that relationship at the end so that it makes this easier should we and if we have to go into this again, or even in just the course of daily business. So it was a really hard thing to go through, but what Noel and Andrés are saying about just making sure that you're building this context and leveraging your intergovernmental partners and your stakeholder groups, right? Understand that you're building this muscle right now and continue to exercise it as we go through the next phase.
Really well said, really well said. With that, we truly want to thank our panelists one more time, Kim, Andrés, Zach, Cooper, Noel, and Jean. Thank you very much. And we look forward to future collaborations, especially because it seems like there is great cohesion around this particular topic of responding with the vulnerable populations in mind. So for those of you who are still on the line, who are attendees, if you are working on a volunteer and engagement-based response to short and long-term needs of the vulnerable populations in your community, and you have questions or comments you want to share and be part of potential collaborations, please contact me, Nicola, at this email address. It's covid19@citiesofservice.org, and it's on the screen as well. So once again, thank you all for being with us and spending this hour and a half. We'll be in touch, and we hope everybody stays safe. Bye, everyone.
See you.
Take care.
Thanks.